It's the appointed time and we have a quorum. I call the meeting to order. I thank everyone for attending this meeting. As the 3 items to be discussed today are relevant to each other, I will allow members to talk about other items. We received 1 submissions and it's been sent by the Secretariat to all of you before the meeting. Item 1 on the agenda, Enhancement of Chinese Medicine an interprofessional collaboration mechanism which combines with scientific evidence and essential features of Chinese medicine, leading Hong Kong's innovative service model to go global. Let's invite the government officials to join us. We have the Undersecretary for Health, Dr. Cecilia Fan, Dr. Vincent Chung, Commissioner for Chinese Medicine Development, Ms. Virginia Leung, Acting Project Director of the Health Bureau, Ms. Chen Yuksum, Head of Community Network of the Primary Healthcare Commission, Mr. Gary Chow, Assistant Commissioner for Chinese Medicine Development, Dr. Ng Chi-sun, Assistant Commissioner for Chinese Medicine Development from the Health Bureau, Dr. Darwin Mack, Assistant Director of Health from the DH, Ms. Roanwa Wong, Chief Manager of the HA, and Professor Bian from the Chinese Medicine Hospital of Hong Kong. Please press the Request to Speak button. There are 3 members who have pressed the button: Mr. Dennis Leung, Mr. Chen Pui-lun, and Mr. Alex Fan. Now I will ask the administration to walk us through the paper. Undersecretary, over to you. Thank you. Good morning. In December 2025, the government announced the development blueprint of Chinese medicine. This is a policy paper to outline the visions for development of Chinese medicine in Hong Kong. It covers Chinese medicine, transmission of culture, and going global. 8 goals and 20 actions are to be set out. After that, the government have been preparing for the implementation measures. We are here in the meeting of the Subcommittee on matters relating to the development of Chinese medicine. In the following meetings, we will share with members our work plan and way forward. Item 1 on the agenda today is the enhancement of Chinese medicine services and interprofessional collaboration mechanism, which combines with scientific evidence and essential features of Chinese medicine, leading Hong Kong's innovative service model to go global. Let me brief members of the relevant policy measures. Over the past 10 years, Chinese medicine have been developing rapidly in Hong Kong. It has become an essential part of our healthcare system. Now, in terms of service, in the 2018 policy address, it is announced that the government will further integrate Chinese medicine into the healthcare system through subsidized services, including outpatient service provided at the 18 Chinese medicine clinics, teaching and research centers. And we are promoting the enhancement of CM elements within the services of the district health centers. Chinese medicine have formed a primary health care network at the district level. The government will continue to leverage on the advantage of Chinese medicine to enhance these CM elements in primary health care. In December 2025, the Chinese Medicine Hospital of Hong Kong was commissioned and by phases. We will come up with a Hong Kong model of an integrated Chinese and Western medicine to develop the 2nd and 3rd tier of the primary healthcare service. In the 15th five-year plan, it is said that we need to promote the revitalization and development of Chinese medicine to improve the Chinese medicine service system and promote Chinese medicine culture, as well as to facilitate CM to go global. Leveraging the motherland's development experience and resources, the blueprint will enhance CM and Our service standards are set at the forefront globally, possessing advantages in our healthcare system, regulatory framework, standard setting, clinical research, and language. In this paper, we aim to embody the spirit of guard the wisdom and forge the future in the development of CM in Hong Kong to advance the realization of vision for Chinese medicine development. We want to participate in standard setting and participate in international CM events so that we can serve as a bridgehead for Chinese medicine to go global and contribute to our countries. The details have been set out in the paper for members' reference. My colleagues and I are happy to take members' questions. Thank you. Thank you, Undersecretary. There are 4 members, and now 5 members who have pressed the button, including Dr. David Lam and Mr. Alvin Lee. We have a tight schedule. We have to cover 3 items in 3 hours, so I will limit members to 4 minutes. Mr. Dennis Lang. Thank you, Chairman. In order for us to develop CM, we need to elevate its status and quality. I understand that CMP can make use of e-health. I'd like to know about the usage rate. In 2025, we passed the Allied Health Professionals Ordinance. We allow allied health professionals to accept referrals from registered CMPs. So I'd like to know about the usage rate of e-health among CMPs and the status with referrals. It is mentioned in Domain 3 of the blueprint that we want to develop Chinese medicines, but we need to make sure that is developed in a safe manner. So regarding Chinese medicine, how can we make sure that people will not purchase bogus drugs on the market? How can we track the source? Thank you. Undersecretary. Regarding electronic health system, that is e-health, in 2022, we developed the functions in the e-health, allowing Chinese medicine clinics to share information and data among themselves. In 2020, through the Chinese medicine funding scheme, we improved facilities of Chinese medicine clinics. We subsidized them in purchasing computers to allow them to be able to make use of e-health more conveniently. As at April 2026, over 400 clinics offering Chinese medicine services are using e-health, and there are 700 service locations of CM that have registered with e-health. Over 1,435 CMPs have registered an account with e-health that account for 13% of the overall number of registered CMPs. Of course, we want more CMPs to make use of e-health. On interprofessional collaboration mechanism, well, I will ask the health department to elaborate. Dr. Mack, please turn on his microphone. Now, on interprofessional collaboration, under the Allied Health Professionals and Chinese Medicine Ordinances, we allow Chinese medicine practitioners to refer patients to, say, occupational therapists and physiotherapists. The Chinese Medicine Division have sent guidelines to CMP teaching them how to refer their patients to physiotherapists and occupational therapists. As for radiography and imaging, currently, CMPs can refer patients to undergo X-ray scan. In the Chinese Medicine Hospital of Hong Kong, patients can receive X-ray service. And CMPs can also make other referrals, say, for example, for testing. We'll look into how we can further promote this. Regarding the quality and safety of Chinese medicine, perhaps we can discuss it at another meeting. I'd like to add this question. Can they let us know about how many referrals have been made? They can give me after the meeting. Mr. Chan Pui-lan. Thank you. It is mentioned in the paper that we want to develop a Hong Kong model of the integrated Chinese Western medicine and promote it to other countries. It is said that, however, Hong Kong embraces a healthcare system that incorporates both Chinese and Western medicines on a dual-track basis, and this model is similar to other healthcare systems with established CM regulation. So what is the features of this Hong Kong model, and how is it similar or different from other models? That's my first question. Second, it is also mentioned in the paper that by the end of this year, the Chinese Medicine Hospital of Hong Kong will launch 24-hour inpatient services. I believe that we have limited bed space in the Chinese Medicine Hospital. We understand that we use Chinese medicine to treat chronic illness, or they focus mostly on rehabilitation. Patients may occupy less time in the hospital. Do we have any estimates or standards as to when the patients can be discharged? Do you have an estimation on the potential demand in the future? Undersecretary. The Hong Kong model is about integrated Chinese Western medicine, ICWM. The hospital authority collaborated with the 18 Chinese medicine clinics under the integrated Chinese Western medicine. Clinical practice guidelines have been formulated to treat certain conditions. In the Chinese Medicine Hospital of Hong Kong, we focus on Chinese medicine. In the ICWM, I will ask the Commissioner and Professor Bian to further elaborate. Commissioner, please. Thank you. In Hong Kong, we adopt a Chinese and Western medicine dual track. For other places, say for example, Australia, Singapore, and Malaysia, our system is similar to theirs, where there is an established Chinese medicine regulation. Regarding the clinical procedures under the ICWM, we don't just bring Chinese and Western doctors and nurses together. Our service on other areas are also of reference values to those places. So through our international collaboration, they can come to visit, and this is how we can promote our service to the rest of the world. I will ask Ms. Leung to talk about the inpatient service. Thank you.
Ms. Leung, thank you. Thank you, Chairman. We are now providing outpatient clinical services as well as daytime services, that is day patient services. We are going to provide 24-hour inpatient services soon. There's a limited number of hospital beds, but we are going to provide more beds in phases. We are proactively setting clinical guidelines regarding designated disease areas as well as rehabilitation. We are accumulating experience when it comes to day patient services. 4 hours in the morning and 5 hours in the afternoon. We are consolidating our experience. We are also seeing how many hours it will take for CM patients to rehabilitate. So by the end of this year, we are going to publish guidelines. We can discuss more the Chinese Medicine Hospital of Hong Kong in our last agenda item today. Thank you. Alex Fan. Thank you. I'd like to ask about e-health. There's a technical guideline as well as a manual regarding e-health, which provides a technical framework in relation to Chinese and Western medicine particulars. Media reports said that close to 90% of the registered TCM practitioners of Hong Kong are not using the e-health system. The utilization rate is on the low side. Only TCM practitioners who have registered for e-health can take part in the healthcare voucher schemes. For TCM practitioners who are older, they may require assistance in this regard. So I'd like to ask about the low utilization rate of e-health. What measures does the administration have? I'd also like to float a proposal to the administration to see what it thinks. The Chinese Medicine Association or DHC district health centers, they can develop a support point regarding e-health at the district level. They can provide guidance, consultation for TCM practitioners at the district so that they can close the digital gap in this regard. This will expedite the use of e-health. Dr. Fan, thank you. TCM practitioners are playing a bigger role in Hong Kong. It is imperative that they use the e-health system so the members of the public will have access to more comprehensive services in a safe manner. I'd like to ask my colleague to give you more information in this regard in order to boost the level of participation. Thank you. Dr. Chung. Thank you. We have been providing support to encourage practitioners to use e-health. We have been expanding the functions of e-health. In the Policy Address 2025, the CE already proposed to allow the flow of information between Chinese and Western medicine in e-health. We have allowed TCM practitioners to access radiology reports, imaging report, laboratory report, and so on. We want to make it even more convenient for patients, and we also want to enhance service quality. We are also making arrangements for TCM practitioners to undertake or undergo training and attend seminars. So the utilization rate of e-health has gone up from 9% to 13% from the 11th of March. There's a subsidy scheme provided to TCM practitioners. Eligible TCM practitioners can buy computer, hardware, and so on. As we understand, a lot of TCM practitioners who are using the healthcare voucher scheme are using an electronic system. That is why in 2024 we launched a subsidy scheme in relation to electronic health record. This system works in conjunction with e-health. That is to allow the information from one system to flow to another system. If this system is connected to e-health, TCM practitioners will not have to replace their existing system. This will provide convenience to the industry. This February, we have already finished the interface of two clinical healthcare management systems. Under the Chinese Medicine Development Fund, we are also providing training for TCM practitioners to get prepared for this. Thank you. Dr. David Lam, thank you. Thank you for making reference to a few important points. I'd like to ask about one area first. Well, that is, when a patient has back pain, waist pain, should the patient consult a Western medicine practitioner, a TCM practitioner, or a chiropractor? Without sufficient guidance, members of the public will not know whom to turn to. According to the manual, it mentions physiotherapist. What about chiropractor? Or chiropractors left out under your scheme? When it comes to interprofessional collaboration, I believe you need to provide more guidance for members of the public so that they will know whom to turn to when they have certain ailments. They need to know whom to turn to. For instance, they may have to consult a physiotherapist or a chiropractor. Only then will they be referred to a suitable or appropriate medical practitioner. Healthcare practitioners will not worry about referring patients to a chiropractor for fear that the medical council may cast doubt on their decision. This is exactly how we can implement interprofessional collaboration. This is my first question, and I'd also like to ask about empirical evidence. Evidence is key. Let me talk about healthcare first. When it comes to empirical evidence in healthcare, basically, Western medicine practitioners treat patients regarding hypertension, diabetes, and so on. So it seems that all diseases have to do with Western medicine. Whichever perspective we look at an illness, we can make use of different areas of expertise. Can we develop designated disease areas in which the TCM can be used to treat the patient? And then in the future, when members of the public have certain ailments, they will turn to the TCM sector. Western medicine doesn't provide detailed information in relation to the potency or effects of the medicine. If they want to know, they can simply ask their Western medicine practitioners. If Hong Kong is to be developed into an international Chinese medicine hub, we do need to use an empirical approach to prove the potency of the medicines. These are my questions. Thank you. Thank you, Dr. David Lam. In December 2022, the government published the primary healthcare blueprint. This shows that the government will consolidate all the resources when it comes to primary health care, be it private, public, or non-governmental resources. We will rely on the Primary Healthcare Commission to consolidate all these resources. We want members of the public to identify the three alphabets. The three letters, that is DHC, District Health Center. We want this to be a network. This network covers all primary healthcare service providers. It also connects all members of the public. This is a good starting point. We will assess the individual risks of the patients as well as their physical conditions. After conducting an assessment, we will provide individualized personal services. We provide physiotherapy alongside traditional Chinese medicine services. We connect the patients to primary healthcare service providers so the members of the public will receive appropriate treatment and services. And I believe Commissioner will tell you more about your question. Dr. Lam mentioned healthcare as well as medicines. Let me talk about healthcare first. In modern medicine, traditional Chinese medicine is seeing a quantum leap. It's been 2,000 years or so. Regarding clinical services, patients would definitely ask you what your diagnosis is. TCM practitioners need to know the diagnosis of both TCM as well as Western medicine before they can appropriately diagnose a patient, followed by treatments. So, under our clinical guidelines, you need to have Western medicine elements, but it doesn't mean that we can forget about the Western medicine elements. I mean TCM elements. You need to know the root cause of the ailment or the illness before you can proceed. In the past 2 decades or so, clinical studies when it comes to TCM in the Chinese mainland have seen a breakthrough. Well, Commissioner, excuse me, time is limited. Well, I can add more information later on. Well, Dr. Lam just now asked about providing more information to members of the public so that they will know whom to turn to, that is TCM or Western medicine practitioners. So can you go straight to this point? Action 1.1, the blueprint, it's about diseases in which TCM has an advantage. Members of the public will know that they can turn to a TCM practitioner when they suffer from such illnesses. We will also mount publicity programs so the members of the public will have more information in this regard. Any follow-up, Dr. Lam? Well, if we need to rely on DHC to let patients know which profession they should turn to, it's quite indirect. We need to let patients know directly whom they should turn to. For example, you need to provide a document so that patients will know that they can turn to a chiropractor, TCM practitioner, or Western medicine practitioner. Thank you. Dr. Alvin Lee, thank you. Under the blueprint, I go along with the direction of primary healthcare. This is very important. According to the document, 90% of TCM practitioners are in private practice. They come from different sources. Chain clinics, NGO clinics, as well as private clinics. Some of them also come from the Chinese Medicine Hospital of Hong Kong and other research centers. That's why I'm concerned how we can effectively elevate the standard of primary health care and how can we incorporate it into our system. I understand the healthcare voucher scheme will be of help. In addition, it's come to my attention that the guideline will serve as a reference, but there are not many TCM practitioners who are under the register. So I'd like to know whether the DHC funding scheme and the healthcare voucher schemes that will be covered under the register, will you attract TCM practitioners to join it? Why aren't you doing this? Undersecretary, thank you. We're going to work with DHC, and I'm also going to ask my colleague to give you more information about this. But overall, we thank member for mentioning this point regarding whether members of the public should turn to a TCM practitioner or a Western medicine practitioner. We respect and welcome their decisions, but we need to prevent diseases. Prevention is always better than cure. The purpose of the DHC is allow members of the public to do more in relation to prevention, such as screening, vaccination. These are first-tier protection. But whether they should turn to TCM or Western medicine, we welcome members of the public to make their own decision. But of course, DHC will see an elevated role of TCM at the district level. Thank you.
喺我哋地區康健中心裏面，
Thank you. At the district health centers, we play the manager role in arranging patients to become our members. We conduct a risk assessment for them, and then we arrange for suitable services for them. Our goal is one family doctor for all, but we also provide matching services for patients. If we detect, say, back pain or inflammation with knee joints among the patients, we inform them of the subsidy scheme that we have. We encourage our patients to not just make use of Western medicine or physiotherapist service. We also encourage them to make use of Chinese medicine services. This is a personal choice, but at the district health centers, we don't just offer personalized service or conduct risk assessment. We also do health education. At different centers, we have Chinese medicine practitioners. In the 18 different centers, many Chinese medicine practitioners have organized classes on Chinese medicine. Thank you. Next, Mr. Chila Wai. Thank you, Chairman. The plans on formulating and developing clinical practice guidelines and clinical pathways set out in the blueprint don't have a timetable. I remember that the administration said in the panel on health meeting that they will come up with a timetable as soon as possible without waiting until 2030. So when are we going to have the clinical practice guideline? When are we going to have the clinical pathway? And when will we trial Chinese medicine in district health centers? Do we have a KPI? It is mentioned that the Chinese medicine will be incorporated into e-health very soon, and now 1,400 CMPs have registered or joined e-health, but that accounts for just 10% of the overall number of Chinese medicine practitioners registered in Hong Kong. How can we encourage them to join e-health? Undersecretary. In December 2025, CMPs were able to join e-health. Now, regarding our plan to develop clinical pathways, I will ask Ms. Leung to answer the question. Regarding the usage rate of EHR, well, we see that is on the rise. We're encouraging CMPs to join it. Most importantly, we need to add more functions to it. In 2025, we allow CMPs to browse imaging reports, blood test reports uploaded by Western medicine practitioners. And when the CMPs find e-health useful in assisting their diagnosis, they will be more willing to join e-health. Ms. Leung, thank you. There are 6 different specialties in the Chinese Medicine Hospital of Hong Kong. We adopt a cross-disciplinary approach in preparing clinical pathways for diseases where Chinese medicine have an advantage. Say, for example, for strokes, long-term pain, and cancers. When the CMP-HK was first established, we decided already that we're going to formulate clinical pathways for those diseases with integrated Chinese Western medicine. Ms. Jeannie Man, thank you. I have a question regarding e-health. Some Chinese medicine clinics told me that their diagnostic system is not compatible with e-health, and they're not able to transfer the health records of patients to the e-health. Some private developers have come up with applications that is compatible with both systems, but they have to pay those developers. Although there is subsidy, it's difficult for clinics to meet the eligibility criteria of the scheme. So very often, smaller clinics are not able to look up records on eHealth. Will the administration review the subsidy scheme? How can we help smaller clinics to upload the health records of their patients so that they can make use of the government system over the long run? Second, on promoting Chinese medicine to the world, it is said in the paper that Hong Kong can serve as a bridgehead because we have a language advantage. Do we have a standard translation for Chinese medicine? Should it be translated into English or Latin? Undersecretary, the questions of the member is very concrete. You said that a CMP relayed the difficulties they face in using eHealth to you. Perhaps I will ask the commissioner to explain to you. Thank you. Thank you very much. I thank the member for the question. In December 2024, we implemented the eHealth connectivity support scheme. We identified 3 different companies in the private sector, as well as the Park Oil Hospital. We looked into how they can connect their health record system to the eHealth. As at February this year, together with the 2 major clinical management systems, we have completed our connection and integration. For smaller clinics, they may not have these systems. We already have the EC Connect in place. This is developed by the government and the hospital authority together for CMPs to use. So if the clinics don't use the 2 systems I mentioned, they can connect their system to EC Connect. We see that there are more and more CMP that have joined eHealth. Now, over 1,435 CMP have joined eHealth that account for 13% of the total number of registered CMP in Hong Kong. We're reviewing into how we can help CMPs upgrade their hardware and software with the Chinese Medicine Development Fund. We want to encourage more CMPs to make use of eHealth. Thank you. Regarding international standards, but I will ask the Department of Health to explain to us about the international standards of Chinese medicine. The Chinese medicine is compatible with international standards and those of the World Health Organization. We want to formulate guidelines and pathways in a common language. As to whether it will be translated into English, that's something that we have to look into. Dr. Mack, the WHO is now formulating a herbal dictionary. With the dictionary, we will have a more common understanding of different herbs, because the names of different herbs may vary among different places. So in May, we're going to have a meeting on the International Herbal Pharmacopoeia. Mr. Chen Hanpan. It is mentioned that in 2026, the CMP-HK will launch 24-hour inpatient service. This is a big step ahead. It is also mentioned in the paper that we want to develop a Hong Kong model. Can I put it this way, Undersecretary? Patients in CMP-HK may be referred from Western Medicine Hospital. These patients have need to receive Chinese medicine service. That's why they're in the CMHHK. How should the referral mechanism be? Should they check themselves in the CMHHK themselves, or should they be referred from other Western medicine hospital? Will the subsidy go with the people? If they suffer from disease that need Western medicine attention, can they seek help from Western medicine doctors in the CMHHK? So on this 24-hour inpatient service, what is the model? For in Western medicine hospitals, if we want to act in the interest of patients, then if the patients themselves or their families are of the view that they need Chinese medicine practitioners' attention or assistance, should we not allow Chinese medicine practitioners to attend to those patients in the Western medicine hospitals? This is how we integrate Chinese and Western medicine. We should not limit the integration in a specific condition. So I think that by launching the 24-hour inpatient service in CMHHK is a big step ahead. So what is the Hong Kong model about? Can the administration explain further? Thank you. Thank you, Ms. Chen. But because you asked about clinical referral, I will ask Dr. Bian to explain it. Regarding the Western medicine, I will ask Ms. Wong from the Hospital Authority to answer the question. In Western medicine hospital, that's a ICWM with Chinese with Western medicine as the predominant service. By coming up with the clinical pathways, patients and doctors as well as practitioners have guidelines to follow on treatment. I will ask Dr. Bian to explain about how it's actually done. Thank you. In April this year, we started providing a 24-hour Chinese medicine service. We hope to make available 93 beds for 39 day patients and 138 outpatients. Patients of CMHHK come from different sources. First, referral from outpatient service of CMHHK. Second, these patients may come from CMP in the private sector. Third, some patients may come from the Hospital Authority. In the inpatient service, we have Chinese medicine practitioners, Western doctors, and nurses. In Western medicine hospital, we also have CMPs stationed there. In CMHHK, we may not have doctors from all the specialties. For patients with different clinical needs, we will hire Western medicine doctors from different specialties on a need basis. On the clinical level, we will formulate clinical pathways and inpatient standards. And if the patients need clinical monitoring, we may admit them. After the treatment goals been met, patients may be discharged for outpatient follow-up service. So we do have a discharge standards that we can follow. We have an admission and discharge standards. Thank you.
黃經理係咪有補充？
多謝陳議員。咁咧就
Thank you. Regarding the development of TCM in Hong Kong, we have been seeing a quantum leap and a breakthrough. Regarding ICWM, that is Integrated Chinese Western Medicine, we focus on the effectiveness of treatment as well as the safety of patients. And we have been developing TCM, and we're going to increase the number of designated disease areas from 3 to 7 in a total of 27 public hospitals in Hong Kong. 80% of public hospital services cover ICWM, that is Integrated Chinese Western Medicine. Going forward, regarding patient journey, we want to enhance the level of participation of TCM, and we are exploring collaboration together with the Chinese Medicine Hospital of Hong Kong. What about the principle of money following the patients? This is a very important principle. Undersecretary, for any public hospital, there's a charge on patients, and after the fees reforms implemented earlier this year, if need be, there is an exemption and there is also a cap. As for Chinese Medicine Hospital of Hong Kong, they have their own charges. Well, Undersecretary, if you charge $200 and if you ask them to go to Chinese Medicine Hospital of Hong Kong, it'd be difficult for the CM Hospital of Hong Kong to sustain operation. When you refer a patient to the Chinese Medicine Hospital of Hong Kong, will you allow the funding or resources given to the patients to the Chinese Medicine Hospital of Hong Kong as well? Otherwise, it'd be difficult to sustain operation. Well, when a patient goes to the Chinese Medicine Hospital of Hong Kong, they will pay the charges of the CMHHK. Yes, I do understand, but a lot of funding schemes are provided by the government. Say a patient needs to pay $5,000 for inpatient services, but you're only charging a patient $200. The CM Hospital of Hong Kong will have to pay the expenses, and that doesn't make sense. Well, CM Hospital of Hong Kong does have a funding service. Well, I made multiple visits to the CM Hospital of Hong Kong. I tried to ask this question indirectly. CM Hospital of Hong Kong provides subsidies to doctors. There are a lot of expenses when it comes to wards as well. Are these expenses funded as well? If you're only going to use the principle of money following the user, you need other resources to be provided to the CM Hospital of Hong Kong as well. This is quite a complicated question. We're going to discuss the CM Hospital of Hong Kong in the third agenda item. While CM Hospital of Hong Kong has a funding scheme as well, funds are provided to the CM Hospital. Ms. Leung, thank you. Thank you for coming to the CM Hospital of Hong Kong. 65% of the services are funded by the government, whereas the remaining 35% are market-oriented services. This covers inpatient services as well. Regarding day patient services, we are receiving funding from the government. We are going to provide 24-hour inpatient services. We will make announcements in relation to charges soon. Like day patient and inpatient services, we are funded by the government. We consider cost and the affordability of the public. For day patient services and inpatient services, they are very well received by the public, and the charges are considered reasonable and affordable by the public. Dr. Ben Chen, well, I have to go to the panel on transport soon. I'd like to say that the purpose of having the Chinese Medicine Hospital of Hong Kong is to implement the principle of money following the user, and patients can bring together with them subsidies to the Chinese Medicine Hospital of Hong Kong to receive treatment. I'm not sure if Mr. Peter Shiu remembers or not, but I'd like to ask about the funding model at present. What are the existing funding schemes, funding models? I hope that the administration will tell us more clearly so that we have a better understanding of the system. Well, Undersecretary, probably we can advance the discussion of this first, and when we have other related questions about this, we can spare those questions and we can discuss this matter right now. Well, I'd like to know more about the funding model. Are you really going to implement the principle of money following the user? Or when you give an amount of money to the CM Hospital of Hong Kong, that be it, you have to admit as many patients as there are? Is it the case? The expenses of each case varies, so how are you going to deal with it? Undersecretary. Let me give you an analogy. That is the hospital authority. Patients only need to make payments that are affordable. The percentage is for us to give an explanation to the council, and in fact, members of the public only need to pay an affordable cost. The CM Hospital of Hong Kong operates in a different manner compared with the hospital authority. CMHHK provides, well, excuse me, Undersecretary, probably I didn't make myself clear enough. Let me give you an example. Professor Low always mentions that the government has exempted all fees for some members of the public. Just assume a patient doesn't need to pay anything in the hospital authority. But that patient has gone to the CMHHK. Supposedly, they wouldn't have to pay. But inpatient services, medicine, drugs, who is going to foot the bill? This is exactly my question. A simple example, if that patient is exempted under the hospital authority, then they will also be exempted under the CMHHK. So who will foot the bill? CMHHK is under a funding scheme, fully funded as well as partially funded. There are different schemes. Say when a patient is referred to the CMHHK, there will be an allowance or subsidy attached to the patient. Is it the case? I need to get this very clear. When you provide a certain amount of money to the CMHHK, then they will have to admit and treat all the patients referred to the CMHHK. So how are they going to meet the expenses? I believe the administration will have to explain to us how are you going to deal with it. I've gone to the CMHHK for multiple times, but still I don't know how the hospital is going to operate going forward. This has to do with the well-being of patients. If it's all about a one-off subsidies to the CMHHK, in theory, CMHHK will have to do the calculations, and they will have to let the administration know how much they need. However, if there is no such estimation, then who is going to foot the bill for the Chinese Medicine Hospital of Hong Kong? Of course, we shouldn't always talk about who is going to foot the bill, but we need to solve the problem. Dr. Fan, well, we provide subsidies based on the amount of services. Ms. Leung, who will take the question? Ms. Virginia Leung. Yes, I'm from the CM Hospital Project Office. As I mentioned, 65% of the services of the Chinese Medicine Hospital of Hong Kong are funded. As Dr. Fan mentioned, we provide funding based on the volume of services. This is stipulated in our contract. Every year, we discuss with operators. we assess the level of services in the next year, and every year we conduct an assessment. And of course, the business development will also be a factor at play. So it is not the case that there is only a one-off, a lump sum amount given to the Chinese Medicine Hospital of Hong Kong, and it will have to deal with all the cases. I believe members can rest assured the government has arrangements in relation to resources provided to the CM Hospital of Hong Kong. I understand members may be concerned about the financial position of the CM Hospital of Hong Kong. Actually, on top of the 65% of government subsidies, 35% of the resources are market-oriented services. There is income resulting from the 35% of services as well. So there are government fundings, and there is also income from the private sector. Thank you for your explanation. Well, the Legislative Council is a gatekeeper when it comes to the financial status of the hospital. If possible, I'd like to have a detailed document about the funding models as well as the expenditure of the CM Hospital of Hong Kong. We want to be clear about this. If you have a document, you can share with us and we can look into the document. This will allay my concerns and answer my questions. Thank you. Probably you can provide supplementary papers afterwards. Thank you. Next, Mr. Chen Kwong. Thank you. The government has been emphasizing that we need to deepen integrated Chinese Western medicine and we need to implement clinical pathways. I'd like to ask about the joint protocols and treatment between Chinese and traditional Chinese medicine. What about if there is any discrepancy or disagreement? Is there any arbitration mechanism? Who is going to be held to account? If in the process there's a medical blunder, is there any clear mechanism or procedure to find out the cause? Who will be held accountable? Thank you. Under Secretary, thank you, Mr. Chen, for your questions. In the CMHK, we are going to develop inpatient services, and we are going to adopt the principle of CM predominant services. And the attending doctor is the TCM practitioner. Regarding the clinical pathways, when we identify a symptom on a patient, well, I can ask my colleague to give you more information in this regard. But, for example, if a patient suffers from stroke, probably the patient needs a physiotherapist, and the patient may have to be referred back to a Western medicine practitioner. Then the Chinese Medicine Council will have regard to the clinical guidelines to decide on the responsibility or the liability. Under the integrated Chinese Western medicine, we are practicing CM predominant services, and the Chinese medicine clinics, training and research centers across all 18 districts are using Western medicine predominant services. So the attending doctor will be the Western medicine doctors. And TCM practitioners will also shoulder professional obligations and responsibilities in the Chinese Medicine Hospital of Hong Kong. They will also follow the clear clinical pathways and clinical practice guidelines. I can ask Professor Ban to give you more information. Thank you. Professor, thank you. In the process, we have integrated Chinese Western medicine to treat patients. What if there is any difference in opinions? First of all, in Chinese Medicine Hospital of Hong Kong, before services were commissioned, we had already implemented guidelines. In handling of cases, we use evidence-based approach, and then we see whether TCM or Western medicine will be better. This is an important principle in clinical pathways. We need to follow the clinical pathways. That is our first method. Regarding our second method, as Chairman mentioned just now, in the CMHHK, the attending doctor is the TCM practitioner. However, if the attending doctor finds that the case needs to be referred to other allied health professions or Western medicine, then such a referral will be made. Then the responsibility will also be transferred to the next doctor or allied health profession who is in charge of the patient. The clinical decision will also rest on the new doctor or allied health professional. Within the hospital, we have a system to handle medical blunders or non-medical blunders. They are responsible for carrying out investigations. Thank you.
Mr. Xiu Kafai. Thank you, Chairman. On this blueprint, if we can promote our Hong Kong model to the rest of the world, then that would be great. And that's a substantial project. Dr. Lam just asked about to whom the patients need to seek help from when they suffer from a disease. As a layman, if I suffer from cold, when I was young, I went to Western medicine doctors all the time. And I found that for a regular cold, if you go to seek help from Western medicine doctors, then you're very often prescribed with heavy drugs that kept you sleepy. And these days, I was asked by my friends to go for herbal tea to treat my cold. So these days, when I suffer from cold, I don't go to Western doctors. I just drink herbal tea. However, if I am having fever, if I have runny nose, then I have to go to Western doctors. If I consult Chinese medicine practitioners, I may need a long time to be treated. For people who cough for 100 days, sometimes they cannot be treated by just going to the Western doctors. Some of them have their cough treated by going to the Chinese medicine doctors after drinking some proprietary medicine. Previously, I hurt my elbow from gym exercise, and I sought help from Western doctors. And I also went for acupuncture. So the integrated Chinese Western medicine may seem straightforward, but it's actually a very complicated model. So how long would it take for you to come up with a Hong Kong model? Your fifth goal is to come up with a Chinese medicine standards. And we need to contribute to the establishment of international standards for Chinese medicine. So how long will it take for us to establish such a standard? Undersecretary. Thank you. If a patient suffers from an illness, they need to see the doctor. We launched this blueprint such that patients will not seek help after they contract a disease. And that is why we have so many DHCs. That's why we promote family doctor for all. We want them to care about their own health. The reason why we have DHC is because sometimes patients don't know who to seek help from. We want to make referrals for them. Very often these days, people go to see Chinese medicine practitioners not just when they suffer from illness. They sometimes go for treating preventative disease. When people show symptoms, they sometimes may not know who to seek help from. That's why we have this district health centers. Sometimes when people feel uncomfortable, when they suffer from muscle pain, they may feel that they just have to take a break or take a rest. However, if the symptoms persist, they may need to see a doctor. They will diagnose your disease and treat you. So there are different levels to it. At the primary level, we want people to have the freedom to choose to seek help from. With the primary healthcare network, we want people to have a starting point where they can seek help from. They should go to see their family doctors, and then, if necessary, the family doctor may refer them to other services. I will ask the Department of Health to further explain, but we have an agenda item on that. In the Chinese medicine testing clinic, we already coming up with the Chinese medicine standards. We have a group of international experts in formulating the Chinese medicine standards. 12 chapters been published covering 357 herbs. This is an ongoing effort. On promoting Chinese medicine globally, well, I just mentioned that we are participating in the formulation of the International Herbal Pharmacopoeia with the WHO. With our experience in setting CM standards, that's how we can promote Hong Kong standards to the world. I saw many CMPs in the past. Sometimes CMPs were of the view that I need to see Western doctors to go for some scans. But given my experience with Western doctors, none of them asked me to see CMP. Sometimes I ask my Western doctors if I should go seek help from CMPs. The most they said is that they have no comment. I think that apart from working on Chinese medicine, we need to allow and encourage Western doctors to know more about CM. Ms. Chen Hao-Yan, thank you. I have a few comments from the perspective of patient. I fully support the development of Chinese medicine. This first item is about how we can combine scientific evidence and essential features of Chinese medicine, leading Hong Kong's innovative service model to go global. Our country has been promoting CM for a number of years. We have a comprehensive specialty systems on the mainland on, say, liver specialty, pediatric specialty, so on and so forth. In Hong Kong, we don't have any CM specialty. Now, looking at the blueprint, we don't have a timetable as to when we're going to have a CM specialty system. Now, it is said that we want to leverage on Hong Kong as a bridgehead for the global expansion of Chinese medicine. Should we not have a CM specialty system before we expand Chinese medicine into the world? Do we have a timetable in the blueprint? When are we going to have a training system for CM specialty? Second, I'm also concerned about this principle of money following the patient. If a patient is receiving treatment in hospitals under HA, if now they need to be referred to the CMHK, the administration said that 65% of the patients were referred to CMHK. So is the cap set at 65%? Should the remaining 35% of the patients go for Chinese medicine clinics in the private market? Is it on a first come, first served basis? I believe that the cap is not exhausted. So at the start of the year, the 65% should not have been exhausted. So is it the case that more patients will be referred to CMHHK in the first half of the year, and in the second half of the year, people will be referred to the private market instead? So how can the 65-35% subsidy ratio benefit patients in the HA? Third, liability issue. In traditional hospitals, the administration said that Western doctors dominate. In CMHHK, CMP will be playing the leading role. For oncology patients, they may have removal surgery in chemotherapy in traditional hospitals, and they may now need relief therapy from the Chinese medicine practitioners. Some patients have certain understanding about Chinese medicine. They may want to consume some Chinese medicine to improve their appetite. However, the Western doctors may be of the view that they should not take any further medication. So who is the one to make the call? If, according to what the administration said, if the patient is in the Western medicine hospital, then the Western doctor is the one to make the call. What happens if the patients make a complaint? By seeing that by not consuming the Chinese medicine, they were not able to sustain the chemotherapy. So as to the decision on whether to consume a medicine, who is the one to make the call? Thank you. Undersecretary. Well, there are 3 questions. I will answer the first question, and then for the rest, I will ask my colleagues to supplement. Regarding training for Chinese medicine practitioners, the model adopted on the mainland is different from that here, and our integration model is also different. I will ask the commissioner to further elaborate. We do have a specialties. But that may not be the same as the same concept in the Western medicine. We do have a designated disease, but we don't have a specialty system. If we need to have such a system, then we need to formulate a pathway from undergraduate to specialty training. We want to uphold professional autonomy. The government need to facilitate this. We need to promote communication. Our model of Chinese Western medicine collaboration is different from that of the mainland. I will ask the commissioner to further explain that. Thank you. The Chinese medicine trade is, well, concerns about the specialty development as well. The government upholds professional autonomy. We need to come up with a consensus. The major goal of the blueprint is to dovetail with national development. If we are to develop specialty system in the CM, then we need to have a platform. There are a few things that we need to do. First, we need a clinical base. If we need to nurture and train a CM specialist doctor, we need a clinical base for experts from Hong Kong and the mainland to formulate a development model and a training system. We have 6 different areas offered in the CMHHK, and very soon we're going to offer treatment on designated disease. When we have accumulated experience, we may develop a specialty system. Different provinces and municipalities have signed memorandum of understanding on clinical service and training. Under the Chinese Medicine Development Fund, we're going to subsidize preliminary research and development on specialty system. The trade may have different views as to how we should come up with such a system. We're going to set up a dedicated task force comprising experts from the mainland and Hong Kong to study the matter. The focus now is to establish a clinical base to make our training more comprehensive.
Commissioner, I'd like to give you more information. Actually, 10 years ago, we already formed Chinese Medicine Development Working Group. We have regular meetings together with the 3 universities. We have a framework, and we will also be continuing to develop specialties of TCM with the help of Professor Bian. Probably you were serving in the Western Medicine Hospital, so you weren't aware of the development of TCM. I'd like to give you this piece of information, so we'll continue to take this forward. All right, thank you. Well, some questions have not been answered. Well, just now, he answered my question on specialties. The CM Hospital of Hong Kong focuses on designated disease areas. Let us read the papers. It's all about enhancement of CM services and interprofessional collaboration mechanism combining with scientific evidence and essential features of CM. It's not just in Hong Kong. It's also available in the Chinese mainland. We need to help TCM to go global. We need to promote special disease program. Just now the commissioner said that they attach a lot of importance to it. But what is the timeline? 10 years? 15 years? There's no mention of the timeline. A blueprint needs to be backed by content. There's no year. There's no timeline. I already expressed my view that there is no timeline under the blueprint. When it comes to TCM, there is no talent training regime. When we let others know, people may be taken aback. This is already available in the Chinese mainland. But after discussion, we still haven't got any talent training regime. The Baptist University of Hong Kong has a faculty of Chinese medicine, so can CU and Hong Kong U. Why? Because we have a strong backing from our motherland. The Chinese Medicine Hospital of Hong Kong was commissioned only this year. So what about students in the past? There's a headquarters or a base in the Chinese mainland. I graduated from the BU as well. Professors are outstanding. They work very hard to look for places which provide clinical practice. So I hope that the TCM sector in Hong Kong can be taken forward. So we have internal medicine, surgery, gynecology, pediatrics, orthopedics, and traumatology, acupuncture, and moxibustion under the TCM. When will it happen? In 2 decades? It's all right, but at least we need a timeline. Thank you. Under Secretary. Thank you, Ms. Rebecca Chen. for your views. We do have short, medium to long-term goals. Just last year, in December, the CM Hospital of Hong Kong was commissioned, and this is driving the development of the industry. Undergraduate training, clinical practice, all these are clinical training of the TCM, and we are already building this bit by bit. For undergraduates, we also focus on enhancing their core skills. At this moment, I don't want to give you any not pragmatic goal. We really want to take forward our plan. I don't want to just give you a year, but we cannot attain our goal. We are in talks with the industry, with universities, and we will take it forward step by step. On talent training and special disease program, in the Chinese mainland, we know that the TCM sector is very mature. The TCM and Western medicine sectors also work hand in hand to improve and take forward their technology. The Chinese mainland, of course, has their own characteristics when it comes to TCM, and Western medicine practitioners also have their responsibilities. But for some special diseases or type of diseases, we want to leverage the strengths of both TCM and Western medicine. That is why we want to have an integrated approach when it comes to Chinese and Western medicine. This is exactly how we can help TCM to go global. I believe Ms. Rebecca Chen means that they want the Chinese medicine's 6 major specialties to be expedited. It is not the case that we are not working on it, but we want to have the positive support by the administration. We want to see a timeline, 3 years, 5 years. We want to have a timeline under the blueprint. Together with Professor Ben, we have been thinking how we can take forward this. Internal medicine, surgery, orthopedics, acupuncture, and moxibustion, oncology. At present, we have 7 major specialties of the TCM sector. We want to have a specialty registration system. If we can make it happen, we can be the pioneer in this regard. That is because in the Chinese mainland, they do not have a specialty registration system. They have special diseases programs, but if we can make it happen, we will be the first around the world, and we can be the pioneer. We may have to put back our time, and in our third agenda item, we're going to talk about the Chinese Medicine Hospital of Hong Kong, and I believe we can make up for the time. Please switch on the mic for Professor Ben. Thank you. In Hong Kong TCM, we do not have major specialty registration. We have gynecology, orthopedics and traumatology, acupuncture and moxibustion. But at present, we do not have a specialty registration system. Mainland experts discuss this area. They wonder what the difference is. We want to have a framework. Whether it is specialty or special diseases, we need to adopt the perspective of special diseases from the perspective of clinical pathways or from the perspective of integrated Chinese and Western medicine. We want TCM to better help patients, and this is what we want to achieve. Chairman, thank you for your supplementary information. I agree with you. Will they take the question on money as well as responsibilities as well? Thank you. Regarding responsibility, all professionals, including TCM practitioners, Western doctors, allied health professionals, they have their own council. For example, we have the Medical Council of Hong Kong. They are responsible for the professional obligation or responsibilities of the professionals under their purview, and professionals need to comply with these requirements and guidance. Be it TCM or Western medicine, professionals work in a team to treat patients. In our provision of services, the whole team is involved. There won't be any change in responsibilities, no matter the model. As long as a professional is involved in the treatment, then that person will be held to account. There needs to be an attending doctor. The attending doctor makes a decision when there is a controversy. As per usual practice, the attending doctor needs to discuss with the team, or they may need to consult a senior doctor. When they make a referral, if they do not make a referral, and if the situation worsens, then this is also the responsibility of the doctor. And when they make the referral, they also need to be held to account regarding the referral made. So I see no change in clinical pathways. All professional healthcare workers shoulder responsibilities. That is, as long as they treat the patients and provide diagnosis, and then they will also be held responsible. Regarding money, we already touched upon our long-term planning. In a moment, we're going to give members a full picture. But in brief, when a patient goes to the HA, that is hospital authority, we will set out clearly how much the patient will have to pay. When there are available exemptions, we will also set that out clearly. Probably partial exemptions, full exemptions, we're going to set out these exemptions clearly. That is not what the patient needs to be concerned about at the time of payment. The percentage point isn't their concern. They only need to know how much they will have to pay, or whether they will have exemptions. The CM Hospital of Hong Kong also has a clear charge regime. 65%. This figure refers to a contractual agreement set out in the contract. 65% of the services need to be provided to patients who will otherwise be denied access to services on financial grounds. 35% of the services can be operated in the private or market-oriented manner. The service capacity may change according to the development of the hospital. For example, how many beds, how much manpower, this will depend on the development of the hospital. When a member of the public comes to the CM Hospital of Hong Kong, inpatient services, outpatient services, how much? Any checkups that are free, these will be set out very clearly. If there are full exemptions granted to a patient, that patient will also have all fees exempted in the Chinese Medicine Hospital of Hong Kong. Well, Chairman, can I ask further questions? Well, yes. Well, my question actually echoes Dr. Ben Chen's question. And other officials said that the service capacity of the CM Hospital of Hong Kong funded by the government stands at 65%, whereas 35% is non-subsidized services. It's very simple. Out of 100 patients, 65 patients can use TCM services in the CM Hospital of Hong Kong. But across Hong Kong, there are a lot of traditional public hospitals. What about the 70th patient who is referred to the CM Hospital of Hong Kong? For the patients after the 65th patient, do they still have access to funding provided under the public hospital scheme? Otherwise, they will have to pay out of their own pocket as they belong to the 35% of service capacities. It's all about service capacity. It's interrelated. A lot of members of the public are allowed to have fee exemption. But what about the 66 patient out of 100 patients? They aren't part of the 65% of the patients.
解釋嘅。咁嗱，我都可以。
I can ask Professor Bian to supplement. But as the CMHHK is developing, we're going to have available more beds. Undersecretary, I fully understand that. So is there a cap set at the HA? You need to stop referring patients when you reach the cap of 65%. Because CMHHK will make available 60% of their service to referrals from HA. 35% of the patients are not subsidized. So what happens when at the same time there are referrals made from, say, Kwong Wah Hospital, from QEH? When the 65% of the service is exhausted, then should the remaining patients pay out of their own pockets? Because you're not accepting all patients from HA. Is there a cap? That's my question. So what kind of patients will CMHHK receive? There is a clear plan in place. Some conditions are ones CM demonstrate distinct advantage. I will ask Professor Bian to elaborate. Chairman, I think my question is very clear. If you can't explain here, submit us with a paper later on. Thank you. The member asked about the service volume. We're talking about 35%, 65%. If the patients from HA exceed their 65% cap, we do have a mechanism in place to cater to them. Regarding sources of our patients, as I said, we have those referred from the day patient clinic, from CMHK. There are patients from private and public healthcare institutions. We're going to set the standards for admission to CMHK and under what conditions they would need to be referred to other Western hospitals. Thank you. What they mean is that when there are more outpatients than expected, the government will allocate more subsidy. Thank you. I have a few straightforward questions. First, of course, fully support promoting Hong Kong's model to the world. But the government's paper is rather vague. I hope that the administration will explain clearly the short, medium, and long-term promotional goal. That is, where the government will promote our model to first, how are we going to implement the promotional models, what goals are we going to achieve. According to the NHC's statistics, CM service is now made available at 196 places and countries over the world, especially those along the Belt and Road Initiative. According to the WHO statistics, there are 113 member states recognize acupuncture and related Chinese medicine treatment model. I wonder if the administration will make use of our status as an international super connector and our triliterate bilingual advantage in promoting the Chinese medicine to the world. Thank you. We do have short, medium, and long-term plan for our promotional campaigns. For Chinese medicine, I will ask the DH to further elaborate on our roadmap and our progress for the global expansion of Chinese medicine. Let me give you an example. For large-scale international or regional CM conferences and events, we're striving to organize more of them, and that will be an ongoing effort. Regarding the ICWM model, the Integrated Chinese Western Medicine model, as I said, our country have a strong foundation on Chinese medicine service. Our advantage lies with our standards, our language, and our clinical pathways. After formulating the clinical pathways, we will promote it to the rest of the world. We hope to tell the world that the integrated Chinese Western medicine model is feasible. We have signed strategic agreement with Australia, with Germany. I will ask the DH to further elaborate when necessary. Overall speaking, in the blueprint, we have set out the 20 actions. Some of them are for short term, some of them are for medium or long term implementation. I am sure that you want to know more about the progress. Now I will ask the Department of Health to talk about the development of Chinese medicine, and then Ms. Leung will talk about the clinical pathways. Ms. Leung, please be brief. Thank you. The CMHHK strives to promote Chinese medicine to the world. As I mentioned just now, apart from with the mainland, we have signed agreements with many countries over the world on talent training and professional exchanges. Members ask how we should resolve conflicts or disputes when we adopt this integrated Chinese Western medicine model. Now we are developing a herbal drug interaction platforms. We have invited many different countries as well as the mainland to join the platform so that we can build a database. And this is how we can promote collaboration among Chinese and Western medicine. Although CMHHK has just been commissioned for a few months, we have implemented many promotional campaigns. In July this year, we're going to host an international conference participated by many CM experts. The Health Bureau will organize the event, and this is a platform for professional exchange. Thank you. Regarding medicine, just now, member asked about the Hong Kong Chinese Materia Medica standards. Through different international platforms, say for example that of WHO, we are promoting our standard. We help provide Chinese medicine industry to elevate their standard to that of GMP so that we can go global. Thank you. Let's take a break for 5 minutes.